Hi, my name is Zachary Town, and as part of the Health Equity curriculum, today we are going to discuss alcohol cessation. So by the end of today's video, you should be able to go through and define at-risk drinking, binge drinking, and alcohol use disorder, define what the standard drink equivalents are for beer, wine, and liquor, describe the burden of alcohol on individual and public health, describe the audit C, and single question screening methods used in the clinic, and then demonstrate the brief interventional skills, including motivational interviewing and frames, and then finally recommend particular resource and treatment to the patients. Going through the treatments will be in a separate video from this one. So let's go through some alcohol drinking behaviors. We have at-risk drinking behavior and binge drinking behaviors. So at-risk drinking behavior is going to be defined differently whether you're male or female, and depending on your age if you're a male. So if you have 3 or more drinks on any day, or 7 drinks per week, and you are a female or a male over age 65, then you would fall into the bucket of at-risk drinking. And then it's going to be 4 or more drinks on any day, or 14 drinks for a male. And then for binge drinking, still slightly different. If you have 4 or more drinks in about 2 hours, this will meet the criteria for males over age 65 and females. And then if you have 5 or more drinks in about 2 hours, that will fit the criteria for males. Now, different from at-risk drinking and binge drinking is alcohol use disorder. It's also referred to as substance use disorder, just specifically for alcohol, and it combines alcohol dependence and alcohol abuse. And it's going to be defined as a condition where a person uses a substance which later interferes with their life, and there'll be 4 different categories. You'll see impaired use or social impairment, meaning their social life is impaired due to their use. Risky use, so they are endangering their body due to their use. And then pharmacological dependence, which, again, as you know, includes this alcohol dependence. So those categories on the last page are being broken down even further. So there are 11 symptoms or criteria overall, dispersed between these 4 groups. And then we have 3 levels of severity for alcohol use disorder. We have a mild disorder, which is only 2 or 3 symptoms, a moderate disorder, which is 4 to 5 symptoms, and then severe is going to be defined as 6 or more symptoms. And of course, there are risk factors for alcohol use disorder, and these are just a few of them. So whether you started drinking at an early age, typically drinking as a teenager, a family history of alcohol use disorder, specifically the first-degree relatives, so your siblings or your parents or your children, a history of trauma, which can be either physical or emotional trauma. Concurrent mental health disorders are not uncommon. And then stressful environments like your home situation or work situation. And then there'll also be the social, cultural practices, so what other people are doing around you. So let's discuss what is a standard drink equivalent. We typically pay attention to 4 different categories of drinks and use those as archetypes for consumption. So all the way to the left, we have a beer or a wine cooler. So this is a commercial beer. Typically, the serving size will be 12 ounces, and they will have 5% alcohol. Moving up slightly from there will be malt liquor beverages or microbrews. Typically, a serving will be defined as 8 to 9 ounces and 7% alcohol. It is worth noting that they are rarely sold in those serving sizes, so it's worth paying attention to both the serving size and the alcohol content for those drinks. And then with table wine, typically you'll see about 12% alcohol and a 5-ounce glass of wine. In the image here, you note that it is less than halfway full. It can be hard to determine exactly what is a serving of wine. And then finally, we have our hard liquor. So this is going to be alcohol that's about 80 proof. So it's 40% alcohol. You simply divide by 2. And again, it's going to be just 1.5 ounces. So a single shot is 1 serving. So in order to talk about the burden of alcohol use disorders, we need to talk about just some of the prevalence data. 70% of adults have consumed alcohol in the past year, 50% in the past month, and a quarter of adults have had at least 1 day of heavy drinking in the past year, and then 16% report binge drinking in the past month. And overall, 7% of adults will have alcohol use disorder at least once in their life. So the last slide with the epidemiology of alcohol use in this graph, I think really point out just how prevalent alcohol use can be and how prevalent alcohol use disorders or risk drinking can be. So about 1/3 of the population will be abstinent, not having any use in the past year. A little more than that, but still about 1/3 will be light drinking, so this is the low risk consumption. And then all combined, the other 1/3 will be at risk drinking or having an alcohol use disorder. And this briefly just goes through some of the clinical responses. So for those who are abstinent or at the low risk drinking, it's just you want to counsel on some of the risks at that lower limit, and you want to do annual screening to make sure. And then when you get to at risk drinking or alcohol use disorder, this is where you want to assess the extent of the drinking behavior, provide some brief intervention or motivational interviewing to help have them change and cut down. And then if they have the alcohol use disorder, you might even go further, like referring to treatment or using medications or mutual support groups. All of those treatments will be discussed in a separate video. So this slide just shows some of the outcomes of alcohol use by systems. As far as the cardiac system goes, you might see data suggesting 1 or 2 drinks a day can decrease the risk of coronary artery disease or decrease mortality. However, this is not at all a recommended preventative strategy. Likewise, some of the data it's not clear exactly what how many drinks brings that effect. As far as cancer risks, as little as 3 drinks a week can increase the risk of breast cancer. Across the board, you'll see increased risk of cancer, and then roughly 3.5% of all cancer deaths are related to alcohol. For neurological symptoms, you may see Korsakoff syndrome being caused by B12 deficiency, and then encephalopathy and neuropathy as well. I think the risks with pregnancy are well known, specifically fetal alcohol syndrome and the risk of stillbirth, but it's worth noting some of the medications also present a risk to the fetus. With the GI, you'll see cirrhosis of the liver or gastritis or hepatitis. And then you also see a faster progression to cirrhosis when patients also have hepatitis C. And then socially, we'll see increased rates of domestic violence, sexual assault, use of firearms, drunk driving, and just overall legal consequences, and then a decrease in productivity. Now, overall, alcohol use is responsible for almost 90,000 deaths a year, and that's roughly 1 in 10 working age adults, which is just astounding. Typically has a cost of $250 billion a year if you want to do the math. It averages out to be about $807 per person, or about $2 per drink. And then I've just broken down the costs by category. So productivity is by far the largest at 72%. And then we see healthcare expenses, criminal justice costs, so like legal fees. And then we'll see motor vehicle costs being notable as well. So it's one thing to know what alcohol use disorder is and how it can impact both the patient and the public. But in order to do something, we need to know whether or not patients are at that level of drinking. And so we screen. Screening should be part of routine medical and preventative care, meaning everyone should be screened, especially if they're coming in for an annual visit. But you want to pay special attention to a few different things. If they have comorbid or co-occurring psychiatric conditions, if they have any new sleep disturbances. A family history of alcohol use disorder is important as well. 50% of the susceptibility is thought to be genetic, and that prevalence really increases with first-degree relatives. If they have a previous or prior substance use disorder, we want to pay attention to alcohol use as well. If they're reporting any new social, legal, employment, or school issues, that would be an appropriate time to ask. And then if they have any accidents or injuries that you think may be influenced due to alcohol, it will be an important time to screen. So, you know when to screen, but how do you screen? How do you bring up this kind of tricky question of asking someone how much do they drink? Well, we have two different ways to start with. We have the single question screener and the audit C. Now, since these are both methods that you could pick one, I've listed the sensitivity and specificity data for both. And if you take a look, they're both roughly similar. Single question screener will be better at finding those who do have an alcohol use disorder who say they do, whereas audit C will be better at ruling out whether someone doesn't have it. However, they both lead to the audit. So the audit has a high specificity and high sensitivity, and this is going to be a longer screening that I'll describe in the next few stages. So, single question screener, it's pretty simple. Simply say, how many times in the past year have you had X or more drinks in a day? And in this case, X is 5 drinks for a male or 4 drinks for a female. And any response of more than 1 day is considered positive for at-risk drinking. And if they have that positive response, you're going to move on to the full audit in order to gather additional information about their behaviors. So, an alternative to the single question screener is the audit C, which is the first 3 questions of the audit screen. Those questions are, how often do you have a drink containing alcohol? How many drinks containing alcohol do you have on a typical day when you were drinking? Then how often do you have 6 or more drinks on one occasion? And if you look back at the definition of at-risk drinking, you'll notice that this helps define that criteria in all 3, whether it's drinks total in a week, drinks in a day, how many days a week. So unlike the single question screener, where 1 day of drinking is a positive score, this has a maximum score of 12, and a score of 3 or more indicates alcohol misuse for females, and 4 or more indicates alcohol misuse for males. So that's how you go about screening. If you do have a score of 3 for females or 4 for males, you're going to move on to the audit. And so here we have the audit, and if you notice, the 3 questions again come right from the audit C, and then the following 7 questions help to further define their drinking behavior. So it can include questions like, how often during the last year have you felt a feeling of guilt or remorse after drinking? How often during the last year have you needed a drink in the morning to get yourself going after heavy drinking? Have you or someone else been injured by your drinking? Again, some of these will be similar to the criteria also found in the alcohol use disorder. It just helps to further define it. And so, just like the audit C, you also score the audit. A score of 0 to 7 constitutes low risk consumption, obviously 0 being no risk. And when that happens, you're just going to provide feedback, just saying like, it's great that you're not drinking, or it's great that you're not drinking much. Here are some things to look out for if you were to start drinking more, and just kind of reinforce that behavior. From 8 to 14 is what's considered hazardous or harmful alcohol consumption, and in that case, you'll provide that feedback, but you're also going to provide some brief intervention like motivational interviewing. And then finally, a score of 15 plus is considered moderate to severe alcohol use disorder. And in that case, you have a few other options for treatment, like referral to a specialist or detoxification or pharmacotherapy. So, say you have a patient who has moderate alcohol use as determined by the audit, what are you going to do? Well, you're going to counsel. So a brief intervention, aka counseling, can help reduce consumption in at-risk patients and reduce alcohol-related harms and mortality. It's been shown that brief intervention, even just one, can help reduce the average number of drinks consumed by 1.6 drinks per week. And when you consider how many drinks a female or a male over 65 can have, 1.6 drinks per week really will lower them down. The two main methods that we commonly see are the frames, which is a patient-centered care shown to reduce alcohol consumption, and then motivational interviewing, which helps the patient to evaluate their behaviors and change in order to conform to their beliefs. So we have a breakdown on how to counsel patients as a separate video, and I recommend you go and watch that. This is just a brief recap of frames. So it's thought to be a precursor of motivational interviewing, and in this case, you'll start off by providing feedback about personal risk. You'll want to reinforce that the patient is responsible for making choices about their health. And while you reinforce that it's their choice, you're going to advise them to change and say, I really would recommend that you consider drinking less or not drinking at all. And then as you do that, you're not just going to let them kind of flounder. You're going to provide them a menu of options like treatment or support groups. And during all of this, you're going to be empathetic because you want them to change. And this isn't a judgment you're passing. This is saying, hey, I care about you. I want you to be healthy. Here's what I would recommend. And then throughout all this, you really want to help them see how effective they are. So increase their self-efficacy and say, I know you can do this. It might be hard, but I have no doubt that you'll succeed. You might even have a lapse or two, but that's fine. That's part of the process, and you can make it through it. Just like frames, motivational interviewing is covered in the video about counseling. Overall, it's about strengthening a patient's motivation and that commitment to change, and it's going to be 3 different phases to that. So at first, you're going to help them find their values or what they value out of their social lives, out of their professional lives, and use open-ended questions to help them explore that. And during this time, you can help build a rapport with the patient, really establishing that you're a confidant and an ally, and you want them to succeed. Once they have their values kind of determined, you can help them to develop discrepancies between their values and their behaviors. It's always good to ask to present the unbiased information, like health risks, because you want them to be in control and you want them to have a choice whether or not they hear that information at that time. So what you'll do is you'll use their values to point out how their behaviors act in the opposite way. So, for instance, someone who's drinking may no longer be able to meet with their family, but yet they say that their grandchildren are incredibly important to them. So you're going to point out, well, you say that your grandchildren are important to you and that you want to be around them, but your family doesn't want to be around you when you've been drinking, and so doesn't your drinking seem to get in the way of being with your family? And then finally, again, you're not just going to leave them without support, so you're going to help them establish a treatment plan. You're going to present them with options and let them really choose what they do. And as you're providing those plans, I thought it would be good to go over just some basic strategies to help taper down or reduce alcohol consumption. So these are just behaviors. So you can say, as a patient, you can say that you're going to gradually reduce the numbers you drink. So perhaps this week it's 2, next week it's 1. You can also do what's called space and pace. So you can space out the length of time between drinks and then space it out or pace it with a glass of water in between. So you have a drink, you have a glass of water, you wait an hour, you can have another drink. Or you can simply mix weaker drinks if you're using wine or liquor. Another recommended one is just to start drinking something else that you don't like as much, just to kind of get out the reward. And then finally, you can set a schedule or a calendar and try to adhere to it. So you can reduce week to week to week, and then say in a month's time, you stop. So I know this is just a blank slide now. I wanted to remind you that there is a separate video going over some of the treatments for alcohol cessation, and that there are also application exercises for both counseling and finding treatment.